A lot of you have been asking me this question about how you document if the doctor is not listening to you, or if you have a change in your patient's condition, what it is that you need to do. So I have written down the steps that I think that you should take. But more importantly, I want you to go ahead and go to the end of this video so you can screenshot all the recommendations that I recommend for you to do. So if you're having a change in your patient's condition, for example, you go in and you notice that the patient is a little bit more lethargic, or conversely, they may be a little bit more restless, anxious, that kind of stuff. This is what you're going to do. Number one, you're going to ask the name of the provider. When you call them with the information, notifying them of the change in the patient, you're going to make sure you know who you're talking to. So before we get to that point, you know that you have to talk to them in SBAR, right? So you're going to go ahead and give report in SBAR, situation background, your assessment of the patient, and you're looking to see if the recommendations that you consider is what's good, what the doctor is going to go ahead and order, and if it aligns with you, right? So we already know that we're going to give report in SBAR. But when you call the provider, it's important to figure out the name of the person who you're talking to. Depending on the different institutions that people may work for, it may be a group of doctors that is assigned to that number, or when I worked at the hospital in Pennsylvania, it would have the exact name of the provider, so I knew who I was talking to. But you need to go ahead and verify the information regarding the name of the provider that you're talking with. After that, you're going to go ahead and in your chart document the exact time that you talk to the physician. So if it's 11:59 a.m., go ahead and put in your note, it's 11:59 a.m. If it's 11:59 p.m., you do the same thing. You document the exact time so that if your chart was being investigated for whatever reason, there is going to be objective data that shows that the issue was either addressed in a timely manner, or conversely, if it were delayed. The other thing you're going to do is you're going to report exactly what it is that the change is. If the patient is more lethargic, unable to arouse, or if they have confused conversation, or if they are more disoriented, if they're more restless, whatever the case may be, if they're hypoglycemic. If you go ahead and you check their blood glucose and their blood glucose is, 47, right? You're going to go ahead and document specifically what it is, the change that you are calling the doctor about. The next thing, if it is a particular lab, as I just talked about, whether it's a glucose or whether it's potassium, say the potassium is 3.2, and you notify the physician. If they don't want to order an intervention, you need to verify with them that that is the case. So for example, you say, hey, Dr. Green, I'm calling for the patient in room 107. She's a 74-year-old female. She's here because she had a history of a stroke, a MCA, 3 days ago. We are doing her labs, and her potassium came back to be 3.2. And the doctor may say, oh, okay, that's fine. So then you're like, did you want to order any interventions? Did you want to order any potassium? Or do you want a recheck of it in case it's an erroneous result, right? You're going to verify with them if they don't want to order an intervention or another step, right? So you're going to document that, and you're going to challenge them on it. Like, you don't want, I just want to verify that you don't want to order potassium IV, or I just want to verify that you only want me to give orange juice or crackers instead of half an amp of D50 or something like that, right? You're going to kind of challenge them on it, because again, as a nurse, I know what the recommendation are for this patient. It's not within my scope to order it, so I'm just checking to see if you know what to do. The other thing you're going to do is to document that. For example, physician notified that potassium is 3.2, no interventions ordered. Okay, that's it. The last thing that you're going to do is to document, obviously, if you did any interventions, and then evaluate that. But in certain cases, which a lot of my clients are noticing, the physician may not want to do anything, and they don't want to address it, or they feel like you're a new nurse and you're over exaggerating, or you don't know what you're talking about. Go up the chain of command. Don't be afraid to go up to the nursing supervisor, to go up to the coordinator, to call a rapid response, whatever it is. If you feel as though the response that you're getting from the physician is putting your patient's health at risk, you need to step in. you need to respectfully go up the chain of command and notify the supervisor. I'm going to step out the way so you can see all I've written down. Get ready to get a screenshot of this, and then continue to like and follow for more content like this, and let me know in the comments if you had any experiences like this. So guys, here you go. Oh, let me get out the way. Go ahead and screenshot this. Hope it's helpful. Like and follow for more.